Thank you, Francis, and my sincere thanks to the Foundation for this beautiful FD Champions Award. I am both honored and humbled to be recognized in this way. In truth, this is a team recognition, as I've worked very closely with a small group of wonderfully dedicated individuals over the past many months, a team we call our Scientific Advisory Board Working Group. This group has been meeting every couple of weeks to drive focused action and explore new and creative ways to fund FD drug development. Thank you, Francis, Faye, Laurent, Laney, and a very special thank you and best wishes to Adrian Gilbert, who I hope is watching. Adrian, we're all praying for your speedy recovery. I left the last in-person SAB meeting held late last year, hopefully optimistic. Our scientists provided very encouraging updates on our three candidate drugs: a gene therapy vector, a small molecule originally developed by PTC Therapeutics called PTC 680, and an ASO, or antisense oligonucleotide, developed at Lorem. All three drugs work differently in the body, but they all result in essentially the same thing: raising the level of fully intact ELP1 protein. This is the protein that, when truncated, creates all the havoc in FD patients. We heard about all the important safety data gathered to date, as well as the very latest efficacy data in animal models. It is incredibly rare and unusual for a tiny foundation like ours to have one such asset, much less three, at this stage of clinical development. We are so fortunate to have such talented and dedicated researchers committed to FD. To finish the job and get one, two, or all three drugs to our FD patients will require significant multi-million-dollar cash investment. And the challenge to secure funds of this nature will be daunting. In addition to being the very proud dad for Justin, who just turned 30 in June, I'm also a veteran of the biotech and pharma industry. So I started some serious networking within and beyond my circle. One call led to another, and I quickly realized that we needed to try something different. And Tikkun Therapeutics was born. As a wholly owned subsidiary of the nonprofit Dysautonomia Foundation, Tikkun, which means restore or repair in Hebrew, was established as a public benefit corporation, or a PBC. Tikkun's mission is simple: to ensure the completion of clinical development and subsequent unfettered access of these drugs to the FD community at the lowest possible cost. Technically a for-profit entity, Tikkun will apply for funding and seek investments that are just not accessible to a nonprofit, such as small business grants or SBIRs, which can be quite lucrative. So we have a logo, we have a website, we're real, it's exciting stuff. In addition, Tikkun can apply to the FDA for what are called orphan drug and rare pediatric disease designations for each of these three assets. Once awarded, these designations provide accelerated drug review times, enhanced IP protection, new funding opportunities, and various tax breaks, and the potential, once our drugs have been approved for the FD community, to secure extremely valuable rare pediatric disease priority review vouchers. That's a mouthful, but these vouchers could entice big pharma to further invest in the drug development for different products. And I'm thrilled to report that just in the last couple of weeks, we received the rare pediatric disease designation approval from the FDA for our gene therapy vector. And I expect to hear similar good news in the coming weeks regarding the gene therapy orphan drug application, as well as our small molecule applications. Of course, earlier today, we heard from Horatio about the exciting ASO progress at Lorem. Our Tikkun team has been very busy this year, with invaluable support from the foundation, and especially our legal colleagues, Ken Sonnenfeld and Jerry Adler. I'm also very happy to share the following. A provisional patent application has been filed for the gene therapy vector. A license agreement with Montana State University is almost completed for the gene therapy vector specific to the FD community. Thanks to Sue Slagenhoff and her colleagues at MGH, a license agreement has been executed between PTC and MGH. where PTC has agreed to provide MGH with a royalty-free license for the small molecule drug for free. The next step would be a sublicense agreement between MGH and Cocoon. And finally, we're in the preliminary talks with Anil Chakuri at Harvard Med to co-submit an SBIR grant application to accelerate the gene therapy vector clinical development. With all of this progress, we must now work to prioritize all the remaining development and clinical activities. Once we do this, we can effectively identify opportunities to accelerate the timelines, economize where we can on costs, and take full advantage of any and all appropriate outsourcing options, such as toxicology studies. So I'm cautiously optimistic. The data tells us we should be. The energy and momentum around Cocoon is palpable. The opportunities for creative investment are real. Cocoon will take a thoughtful and realistic approach to the task at hand, but with a great sense of urgency. Our unwavering goal is to continue to translate these efforts into meaningful results for the patients. As I watch Justin endure FD's everyday symptoms, I don't think in terms of a cure, but I do think in terms of further lessening of these symptoms, and most importantly, slowing disease progression, so vital to our small and aging FD population. Thank you so much again for this beautiful and heartfelt recognition.